Knock, knock. Hello, how are you today?
I'm good. How are you?
I'm good. I'm Raina. I'll be your nurse for this shift.
Okay.
I'm going to do a postpartum exam on you, if that's okay.
Of course.
Awesome. So I'm going to pull this curtain back, and I'm going to wash my hands and put some gloves on. And I'm going to raise the bed up to my liking. And the first thing we're going to do is some vital signs, okay? So I'm going to put your temperature, put your blood pressure cuff on, check some pulses. And then we're going to look at respiration rates while we do pulses. Okay, all that's good and taken care of, thank you. So the first thing we're going to do today for our postpartum exam is we're gonna look at your breasts and we're just gonna palpate around them. Make sure that there's no redness or bumps or if they hurt. Is there any pain in that area?
Just mild soreness.
Okay, you're a first-time breastfeeding mom, right?
Yes.
Okay, so are your nipples chapped or is there any discharge at all?
No.
Okay, so everything's doing pretty good in that department?
Yeah.
Okay, so the next thing I'm going to do is listen to bowel sounds, okay? So I'm just going to listen in all four quadrants, starting with the lower right. Okay, so I do hear those bowel sounds. They're pretty noisy, so that's good. It means our stomach's waking up. Have you been able to go to the bathroom at all, have some bowel movements?
Yes.
Okay, perfect. If you end up feeling a little constipated at all, we'll give you some stool softener, but the best thing to do is drink lots of fluids and to get up and walk around.
Okay.
So while I'm there, I'm going to listen to your heart and your lungs, okay?
Okay.
Okay, can you breathe in for me? Okay, breathe in for me again. Okay, perfect. So your lungs sound good, your heart sounds good as well. And the next thing I'm going to do is to check your uterus. So our fundus is the top of our uterus, and after birth it starts to settle back in the abdomen, but we have our fundus up here a little bit, okay? If you want to feel right there, you'll feel that it's firm, which is good. So I'm going to just support down here, and I'm going to just massage it a little bit and palpate it. So it's firm, midline, and everything's intact there. If you notice any signs of bleeding more than you've had recently, then just massage that area. So that way it'll firm up and control your bleeding. Okay. It's also a -2 below the umbilicus, so it is descending back to its normal spot. Okay, the next thing we're going to do is, I already talked about the bowel sounds and about the potential for constipation. We're going to talk about bladder next. So have you been able to urinate today?
Yes.
Awesome. Has there been any stinging or foul smells while you've gone?
No.
Okay, that's good. If that changes, let me know, because it could be a sign for a UTI and we don't want that. But right now, it looks like we're good. Next, I'll have you lay on your side. If just, if it's painful, take your time. Thank you. So I'm going to lower her underwear and look at her pad. The lochia is moderate and red, which is what we want. Have you changed your pad in the past hour?
Yes.
Okay, so this pad here is about an hour old almost, right?
Yeah.
All right, so for the amount of time and how much blood that's there and the color, that's what we want to see. That's normal for the hospital. Next, we want to look at an epidural site, except she didn't have one, so she went all natural. And then we want to look at any hemorrhoids, which awesome, doesn't look like you had any. And then we didn't have an episiostomy, did we?
No.
Okay, so we just had minimal natural tears that the doctor fixed up. So I would take my pen light and just look in that area, and I would see that there's just minimal redness, there's no drainage or signs of infection, which is great. And I'm trying to think if there's anything else while I'm over here, which I don't think there is. Perfect. So I'll have you lay back on your side. Awesome. Or your back when you were on your side. And next I want to go down to your legs. So for someone who's been in the hospital, one complication that can happen are DVTs, which are blood clots. So a good way to prevent that or minimize your risk is to get up and walk, and to just keep an eye on your calves. They don't look swollen. They don't feel hard or squishy, like there'd be edema. Are they in pain at all? Do you have any pain?
Only a little.
Okay, so just a little, probably from that natural pushing. There's no edema in the ankles or the feet either, which is good. Again, just getting up and walking around helps with that. And then finally, are you in pain at all? Like is it very painful anywhere? Like on a scale of 1 to 10, how much pain do you have? Would you say?
Probably just like a 3.
3. Okay. Do you need any pain meds for that?
No, I'm okay.
Okay. And then emotionally, how are you feeling?
I'm feeling pretty good.
Feeling good? Okay, just want to see your baby, right?
Yes.
Awesome. Well, I'll go check on that for you, and thank you, and let me know if you need anything. Here's your call button, okay?
Thank you.
All right, see you soon.